one aspect of care that we all need to be aware of in order to give our patients, our family, our loved ones the best of what we can do to preserve that quality of life from now until, from the start of serious illness till the end. So that's why the title of my presentation today is Palliative Care, Know Your Options, Share Your Wishes. Because again, you cannot share your wish if you don't know what your choices are. We'll start with just the contents of my talk. Got the definition, we'll discuss about palliative care and hospice, palliative care laws, the disease continuum, advance directive, MOLST, DNR, and artificial tube feeding. I'd also like to acknowledge the presence of Diane Morris, a social worker from the Manor, and Lynn Bogart from hospice, just in case any of you guys will have a question with regards to that. Please feel free after the talk. So now, current trends right now, what we're facing is life expectancy continues to increase. As we probably heard in the news, really there's really a decrease in the incidence of heart attack, stroke, cancer, all because of the advances of modern medicine. And we know what that means for us. It means to say people will live longer and longer. Unfortunately, you can never reverse aging. And comes with aging, our debility, the chronic diseases, that again we have to deal with. That's why we need to understand what we're facing so we can prepare better on how to deal with it. And then prevalence of chronic diseases, as I mentioned, the more people get older because of advanced modern medicine, the more chronic debilitating illness we are going to be facing, so we need to be prepared for it. Unfortunately, in this culture of ours, is still up to this time, in some cultures, in some sectors, death is still seen as optional, as if there's a cure for everything, which obviously all of you inside this room don't believe for such a cure. And that, you know, some people still believe plan is just for the frail, disabled, and elderly. And obviously there's always going to be gaps in care and quality issues. So what is palliative care? Palliative care is both a philosophy of care that focuses on quality of life and alleviation of symptoms. It's also a very highly structured delivery of care that considers the physical, mental, spiritual, and social well-being of patients and their families. It affirms life and views dying as a normal process. It neither hastens nor postpones death. Its goals and focuses, again, as I mentioned earlier, is quality of life, family support, or social support for that matter, and symptom management. Now, what is hospice? If we could compare it, palliative care is like a bigger umbrella underneath one sector is hospice. What it differs basically for palliative care, again, it starts at any time when there's a chronic illness we want to deal with. Once we know the disease is uncurable or there's no treatment but just support or halt the decline, then I would think palliative care is proper to be started. Having said that, hospice is one kind of palliative care that is reserved for patients terminally ill. And by Medicare criteria, to be able to be entitled for Medicare reimbursement, you have to have a prognosis of 6 months or less if the disease follows its natural course. Obviously, it's not written in stone. As long as there's 2 doctors going to certify at the end that 6 months left, you're still there, but still the disease on follows its course is going to be that. It's still going to be qualified under hospice. And again, same as palliative care, it provides team-based approach services to patient, family, and caregivers in all care settings, from the home, assisted living facility, nursing homes, and even hospital. Now, as I said earlier, there are certain conditions for to be qualified for Medicare hospice. So Medicare hospice, these are some of the conditions that once you have it, it's probably good to consult the hospice, consult in that area. And at this point in time, good thing we're making progress to it, linked to public health more value, but actually, in the beginning, there's only very few people enrolled in hospice because people think hospice just for the imminent need, which is not true. So as much as possible, we want to have hospice early in the process so that we could make a difference much more in the quality of life for our dying patients. And these are the conditions they'll be qualified for it. Obviously, each current condition, it's not just that condition. Under Medicare stipulations, it says different criteria for those specific diseases. So some of those diseases are severe dementia, Lou Gehrig's disease, severe liver disease, severe lung disease, fair tribe, AIDS, stroke and coma, and cancer. And again, used to be being only for cancer. Now we see more and more demented patients, their end stage, employing hospice. So when do we consider palliative care? So palliative care, we need to consider this and think about it when our loved one or somebody known to us has multiple repeated ER visits or hospitalization for a chronic disease. It's when they feel or sense that you do not all have the information that you need. And third, that you worry about the future. These are certain conditions you want to make sure you try to seek the help of a palliative care team or a palliative care consultant. And it's also when you're concerned about the effects of your illness on your family and loved ones. Again, it's a team-based approach. That's why it's important for us to call palliative care team to come in the picture once you're feeling bad. When medications are not adequately helping your pain, shortness of breath. When you are worried about getting the right treatment if your disease suddenly gets worse. With the government awareness of the importance of palliative care, there's really recently enacted laws last year to highlight the importance of palliative care. First, the Palliative Care Information Act that was enacted last February 9th last year. It basically requires all healthcare providers to inform their patients about the condition, the prognosis, and what their options are. It was highlighted and expanded by the following law, Palliative Care Access Act, last September 27, which requires all hospitals, nursing homes, home care agencies, assisted living facility to make sure that they establish policies and procedures that their patients will have access to palliative care consultation. So those are the new laws emphasizing it. And rather than calling disease continuum, I would say this is life itself in the process here. First, we start as healthy independent. As we get older, I don't believe anybody who gets older would have no single disease. But anyway, if nobody won't, still they will have functional decline. Comes functional decline is advancing chronic illness, and with all the interplay of all chronic comorbid conditions, it causes increasing frailty until death. So our goal basically is maintaining and maximizing health independence. So palliative care can enter advancing chronic illness phase, and then from that point, we move forward other palliative care or hospice, as the graph shows. Now we go to advanced care planning. Now that we know what palliative care is, how the disease continuum throughout life goes, so what is advanced care planning? Advanced care planning is a process of planning for future medical care in cases that you suddenly lost your decision-making capacity. It's appropriate for all adults and subset with life-limiting illness, and mind you, for all adults, including people, anybody about 18 years old. And it focuses on conversation and addresses surrogate decision-making and end-of-life preferences. It results in the complete use of legal documents. As I said, it's a product plan for future medical care. It's a continual process and not merely a document. That we need to re-emphasize. It's a process, not just a document sitting wherever it is. And it assists you in preparing for a sudden unexpected illness. It ensures peace of mind for you and your family. So how to do advanced directive? Actually, there's some booklets in the table, and hopefully you have all distributed that one. So first, how do we do the advanced directive? First, you have to learn about what advanced directive is. And basically, we're all here today to know that. So that's the first step. And second, we remove barriers. We remove barriers that prevent us from doing such. Third, you motivate yourself, your family, and your loved ones to know it, to have it done. And then complete your healthcare proxy and living will. In fact, in this booklet, at the end page, aside from those parts being fully elucidated, on the end page, there's the healthcare proxy form, the New York Living Will, and the most form, which we're going to talk about later. The good thing about this book too is got this pocket version of the healthcare profit. The last page, you could fold it, fill it up, put it in your wallet because you never know in case of emergency. At least you will know your wishes are on it. So the last part is very helpful for this book. Once you complete your healthcare process in living will, again, it's not just a document, it's a process. You need to be reviewed and updated every time. And again, some people, depending on their stage of life, things change. Like in cases of death of a spouse, divorce, or birth of another children. Those things kind of influence what's currently going on. Just it needs to be reviewed and updated. So how do you complete your healthcare process or living will? First, start with a conversation. Talk to your provider, healthcare provider, talk to your family, your loved one. Have them know your values and beliefs so that you will be assured that, just in case the time comes where you're not able to express yourself, your spokesperson will be able to express in your behalf what you value and believe, especially end-of-life preferences. So choose the right healthcare agent. And in this book, kind of gives you, from page 7, what to keep in mind in choosing the right spokesperson. Again, it's good to know this, and please spread it around to your families and friends. It's important to know this so you can come up with a better plan for this. Now that you have chosen the right spokesperson for you, you might want to make sure that you discuss your values and beliefs with them. Again, highlight your values and beliefs in your designated person because he or she will be the one to express in your behalf whatever you value them with. And understand life-sustaining treatment. And then once it's all done, it's very important to make and share copies. Again, make and share copies. It doesn't end up in your portfolio or wherever it is. Again, it needs to be of use. And the way you do it, basically, you make and share copies of it. I was talking about the most earlier and healthcare processing living will. Initially, before 2007, there's only the healthcare processing living will. However, with different care settings from outpatient to nursing homes to hospital, they have their own policies for having a DNR or whatever. At the end of it, if there's confusion, there will always be confusion which one is valid in this place compared to the other institution. That's why there's a core group in Rochester, which is the community-wide end-of-life healthcare initiative, which started there. I'm now a part of that, trying to disseminate the most information to everybody because most is important supplement to further progress our process for ensuring this. So again, the healthcare process living will is composed to most. Healthcare process living will are for all adults. Again, 18 years old and above. It's completed ahead of time, and it only applies when the decision-making capacity is lost. As compared to the most, which is only for those with serious health condition or nearing end of life, but anybody with serious chronic condition can opt to do one. And it applies right now and remains valid even after decision-making capacity is lost, as compared to the healthcare process or the living will, which again is valid only during the time that you're not able anymore to make decisions. And the most further is a set of actionable medical orders. In fact, the most itself is a medical order by itself.
Does anybody need one?
And again, MOLD stands for Medical Order for Life-Sustaining Treatment. And as you can see, it's a very bright pink form for one main purpose. It's bright pink so that in case of emergency, EMS or any person that attend to you will immediately see it. So it should travel with the patient wherever the patient goes. If you go to the hospital, bring it with you. If you get discharged from the hospital, make sure you have the original copy. If you're in a nursing home, nurses are instructed to have the most go with the patient to the hospital. Once going back to the hospital, the patient should have it. And again, it's bright pink, but in the house, it needs to be put by the refrigerator, by the phone, or by the nightstand, so in case of emergency, people